Hi, I'm Dr. Tony Salamay, and what I'd like to do is talk to you about a diet for acid reflux. So, for acid reflux, millions of people suffer with acid reflux on a day-to-day basis. And as we know, acid reflux is an issue with our acid going up the sphincter, the lower esophageal sphincter going up to the esophageal area. There are things that affect our reflux. There are things that we eat that we can pay attention to that can make the acid reflux worse. So what I'd like to talk about is what are the common things that we find that affect acid reflux, and we'll get into the things that we can do to help prevent some of that reflux going up that tract. So number one is we want to avoid foods that we're sensitive to. So typically with acid reflux, we usually hear, don't eat the tomatoes, don't eat things that are acidic, which is true. We're going to get into that when we get into some foods that you can actually eat that are not acidic, that don't really destroy or affect the pH levels that destroy the lining. But one of the main causes of acid reflux in terms of exacerbation of symptoms is gluten and dairy. Those two things can really cause havoc on the digestive tract, and that can cause contents to spill over into the esophageal lining into going up. Basically what it does is it increases the gastric yield pressure that goes up that esophageal area. So what happens is our immune system can't effectively digest the actual casein and gluten, and what happens is our body starts to inflame. That inflammation causes all that pressure to build up in the stomach area going up the whole esophageal area. So that, along with soy, corn, and eggs, are usually, these are all common food sensitivities that can really cause and affect the acid and cause the buildup of the reflux. So other things that can affect too, of course, are foods that have a pH of less than 7. So normally the pH of our body should be around a little bit basic, so 7.4, 7.45. And it's really tightly regulated, so we really can't alter it too much. But what happens is, in acid reflux, normally we should have that acid that's really in the stomach area. It should not be up in the other areas of the body, in the tissue, such as the esophageal lining, or in the sinuses, or in, it can go all the way up into the tract. So what we want to do is we don't want to consume foods that are going to further attribute to the reflux going up. Ideally, what we want to do is we want to close that valve, and we want that valve to be closed and tightly, the pressure to be tightly proper, so that I can keep the acid that normally that the stomach produces inside that stomach area, inside the upper gastrointestinal tract. But in the meantime, I do talk about it in other videos of what we can do to help assist and actually treat acid reflux naturally without having to go through perhaps surgery or other means. So there are other options for it as well, of course, but I always want to start with the least invasive and start naturally to see what can be done to help ameliorate or control the acid reflux. So what we're going to be talking about is through the diet. So yes, any food that is acidic, so 7 is neutral, anything above 7 is alkaline or basic, and anything below 7 is considered acidic. So we want to make sure that we're consuming foods that are not acidic. And I hate to break it to you, but unfortunately most foods are acidic. So it's very, very hard. To follow this type of diet is really a hard diet to follow, but it does work. If you do follow the diet for 30 days, you may see some big change in terms of your gastritis, in terms of the reflux, and it can help tremendously. So the foods, we're going to talk about the foods in a minute, just what foods are actually permissible or what are alkaline that you can consume. Other things are of course, we know that sodas and carbonated drinks are very acidic, so we know that the pH of them are pretty low. So also alcohol and cigarette smoking and all of that, and even coffee, caffeine can be very acidic, and we don't want to consume those beverages. So we want to consume beverages that are above 8, because what happens is if we consume beverages that are above 8, it neutralizes pepsin. And pepsin is really what causes a lot of the destruction. So when you take your PPIs like Prilosec or Nexium or what have you, and you take these, what they do is they block your acid. What they don't do is they don't block pepsin. And what pepsin does is when it goes up into the stomach area, it goes up the tract, it can get lodged in the tissues and cause all this destruction. So what we want to do is we want to consume we want to consume beverages that have a pH of 8 and above. So I pretty much drink, for the most part, I try to drink as much as possible alkaline water, and I use Essentia. There's other different types of alkaline waters, so it really doesn't matter, but you want to make sure that you have a pH of 8.5 and above to neutralize, or at least 8, but I would really prefer 8.5 and more to really help neutralize the pepsin that is associated. So that can help with the acid reflux, and that can help inhibit some of that pepsin that's affecting our tissues. So then we're going to go into, I want to go into the actually alkaline foods. So asparagus, spinach, rice, even corn, but if you're sensitive or allergic to corn, you don't want to consume it. Kale, peas, and then the list goes down: fish, eggs, cantaloupe, and watermelon. These things are actually good, and they're alkaline, and they won't really mess with our pH system too bad in terms of it won't be acidic, so they won't be affecting us adversely. So these are some foods that I really had to be really selective of what foods, because so many things, even fruits and other vegetables can be even on the acidic side. So it's very difficult. But there's a great book by Dr. Aviv of the Acid Watcher Diet, and they go more in detail as far as the diet, as if you're looking for more of a deeper look into the diet. Again, it is a hard diet, but it can be very helpful, and it can be it could help perhaps even reverse your acid reflux. So it's possible. So that's one of the things I wanted to share with you. And then we also, and I'm sure your doctors may have explained this to you, we want to consume foods that are smaller and more frequent. We don't want to have foods that are within 4 hours of going to bed, because what that does is, of course, laying down in a recumbent position that can allow the reflux contents to go up and affect us. So we want to make sure that we're eating smaller meals, that we can digest them, so we're not getting this backflow pressure going up into the esophageal tract. So no food before bed. You give yourself at least 4 hours of rest time before you eat, before you go to bed, so you're not having contents. And also, you want to sleep on your left side, because that helps push the stomach down. So that also is helpful when you're having any acid reflux. It helps keep contents and pressure down. And you want to have, if you have a bed that reclines up to about like 6 inches or so, at least 6 inches, that can help. That can help with gravity. Of course, we can use gravity in this case, we can use gravity to our advantage and help bring the contents pushing down and not coming up, of course. So some things that you can do also dietary-wise that can help with your acid reflux is you can take digestive enzymes. And what digestive enzymes are, or AKA food enzymes, these are enzymes that help break down food. So we have carbohydrates, we have proteins and fats. Our digestive enzymes, we have proteases for protein, we have amylases for carbohydrates, and then we have lipases for fats. So taking digestive enzymes can help. Some people swear by taking apple cider vinegar, and for some people it may help, but it is acidic. So if you truly have GERD, or you truly have gastroesophageal reflux disease, I do not recommend taking any type of betaine hydrochloride. A lot of times they're involved in the enzyme formulas, but be mindful that that could irritate the lining, especially that it is acidic, and that can cause more of a problem if that valve is open. But in some cases, taking betaine hydrochloride or HCl, that can help, because it can help the body digest better, but it just really depends. Some people have acid reflux due to the actual valve being open, and some of it is they're open because of other reasons. So it's really complex. I can go more into it in another video and explain why certain apple cider vinegar can be helpful and why it can be detrimental and damage your own lining. So I would say, as a general rule of thumb, I would not be consuming it, and I would be taking enzymes and following a diet that is alkaline based. So anyway, I hope this video gives you some more information about acid reflux and what you can do about it. And as far as dietary wise, I hope to be giving you more videos on same and similar topics and other topics. So if you like what you hear and you want to hear more of these videos, please hit that like button and subscribe button, and don't forget to hit that bell notification down. And I really appreciate it, and it will help us give you more updates on our videos and what's new and coming out. So again, I appreciate you listening and tuning into it. I'm Dr. Tony Salamay, and I want to wish you a great day.